This viral disease is distantly related to smallpox. We call it monkeypox because it was first found in colonies of monkeys. Monkeypox usually spreads from person to person during intimate contact, but you can also get it from an infected animal. Monkeypox causes a rash on the skin, and these sores turn into pus-filled blisters that eventually form scabs and fall off. It takes 2 to 4 weeks for the virus to run its course.
Monkeypox is an illness that's caused by an orthopox virus, and orthopox viruses are the genus of viruses that variola is in. Variola is commonly known as smallpox. And so the good news about monkeypox, though, is it's much less severe than smallpox. We don't remember smallpox outbreaks, we're too far out from them, but smallpox outbreaks used to be very severe. This outbreak of monkeypox, although similar with symptoms, is not causing as severe of an illness. It's important to understand the differences between monkeypox of old and our current monkeypox outbreak. And so monkeypox originally is from Africa, and there's 2 different strains of monkeypox virus. So there's the Western African strain and there's the Central African strain. The outbreak that we're seeing now that's worldwide is with the Western African strain, and this is a more mild disease compared to the Central African strain. But what's different about this one is that in the past, monkeypox outbreaks were associated with animal exposure. So people in Africa would be exposed via a scratch or a bite to an infected animal, and they would get monkeypox through that. What we're seeing now is actually a big increase in person-to-person spread of the disease. So the virus has managed to integrate itself really within our sexual networks within the world and spread worldwide. So people are contacting this through close personal contact. It is more common right now in men who have sex with men, but that does not mean it's only an illness for those people. It has been spread by close personal contact, including heterosexual contacts, just by family exposures, and even by linens, towels that have been exposed. So the signs of monkeypox illness typically begin with fevers in the early days of the symptoms. You can get a high-grade fever, you can get myalgias or muscle aches, you can get chills, you can get back pain, and then you can also get lymphadenopathy, which is swollen lymph nodes. This then progresses to the rash, usually around day 3 to 5 of illness. The rash is very unique. It's not a typical rash that you would see. It typically starts as what we call a macule. Macule is a flat lesion on your skin that you can't really feel. It then progresses to what we call a papule, okay? So you're gonna get then when you can feel the patch itself, okay? And it can be vesicular when it's filled with clear fluid, or it can be a papule when it's filled with white fluid. Then this crusts over and then the lesions heal over. These are very painful lesions. They do tend to be located more on the face and the hands and legs as opposed to the trunk, but we're also seeing them in the genital area as well. The most important thing to preventing the spread of monkeypox is really making sure that people who come down with monkeypox are isolating themselves. That's the most important thing. So again, it's spread via sexual contact, but also by close personal contact. And so if you're exposed to anybody who has any open lesions, it's very important that you stay away from them, keep them covered, don't share any linens, any towels, or anything like that. And it can also be spread by close face-to-face contact, so you want to make sure that you're not having that close personal contact with people. If somebody's concerned that they have symptoms of monkeypox, the most important thing for them to do, again, is to isolate themselves. In terms of seeking treatment, there is not a lot of treatment available for monkeypox. For people who are not immunocompromised, it is just supportive care. So things like Motrin for the fevers and the aches. And it's really just time at that point. However, if you are immunocompromised or you have symptoms and want to be tested, the most important thing to do is to call ahead to wherever you're going to be going, whether it be your primary care physician or an urgent care physician, and let them know that you're concerned that you have monkeypox, because we do have to do some isolation procedures to make sure we keep everybody safe. The treatment for monkeypox is generally supportive care, and that's just taking care of fevers and the muscle aches. If you are immunocompromised, and these are people with severe immunocompromising conditions like advanced AIDS or organ transplantation, for those patients, there is an antiviral treatment available called TPOXX. It's available through the CDC under investigational drug use, but it is available for us to use here in the local area as well if needed. There are 2 vaccines available for monkeypox, but they are not widely available at this point. So right now in our local area in Virginia, all of the vaccination campaign is going through the state health department. They have a very limited number of vaccines available. And from our last information update that we've gotten from them, what they are doing is contact tracing to decide who necessitates the vaccine, most importantly at this point. We certainly do not need widespread vaccination for monkeypox right now. It's really just targeted to people who are at the highest risk or who have been exposed to monkeypox.